Welcome back. It is Valentine's Day. Yes, it is. And so we thought it would be appropriate to talk about the health of your heart because heart disease is the leading cause of death in Canada for men and women. Well, naturopathic Dr. Olivia Rose joins me now with some important tips to keep your old ticker ticking.
That's right.
How's it going?
Good. How are you?
Yeah, excellent. Thanks so much for coming in. Obviously, this is incredibly important and obviously very timely. It is Valentine's Day, but it's also Heart Month.
It is. Yes. So, you know, I think it's important to emphasize that a lot of the risk factors for heart disease and cardiovascular disease are within our control. So if you make those dietary changes and do those lifestyle changes, you can prevent heart disease.
They're the basics. What would you say?
Yeah, so first thing you want to do is avoid sugar.
Avoid?
So avoid sugar, excess sugar.
Okay.
Right? So there's a study that came out showing that if sugar represents 25% of your caloric intake, that will double your risk of heart attack.
Is there bad sugar, good sugar?
Not really. I mean, there's good sugar if it's in your fruits and vegetables, right? But you just want to watch the sugar content in your anything that you purchase, like yogurt, that kind of thing.
Okay.
So sugar, avoid.
Big one.
A lot of these components here are representative of the Mediterranean diet, which has been shown in studies to be as effective or even more effective than statin drugs at reducing your risk for heart disease. So we have fish. If you eat 2 servings of fish a week, you can reduce your risk of heart disease by 30%.
Okay.
Right? So that's pretty significant. If you don't like fish, you can take fish oil capsules as well.
Good replacement.
Right? Yeah, excellent replacement. The other thing that's emphasized in this diet are nuts and seeds. So unsaturated fat and trying to reduce and limit your saturated fat from meats.
But people say that and they grab bags of nuts and they eat them, but that's not always a good thing. I mean, you want obviously moderation, but how much is too much?
About a handful.
Handful a day.
A day.
Okay.
And it doesn't even matter what nut that you choose. So just go nuts with the nuts.
But take out the salt, I think.
Take out the salt, so raw nuts are going to be best because that will preserve the nutrients and the vitamins and the minerals. So that's really good. The other thing is garlic. Do you like garlic?
Hate it.
Okay.
I don't know.
Garlic is good for you.
I don't know. I'm the only one in the world that hates it.
Yeah.
I don't know. I mean, I can deal with it. I just
in food, like just 1 clove a day can help.
Clove a day?
Just 1 clove a day. You
can
chop it up.
Kiss anybody. It'd be tragedy.
So if you add garlic to your diet, it reduces the stickiness between your red blood cells and your platelets. That increases blood flow, decreases inflammation, right? So part of the risk factors for atherosclerosis, which is the clogging of the arteries, is that stickiness between your red blood cells and your platelets and all that inflammation. So it can reduce that. The other thing is good old extra virgin olive oil. Extra virgin olive oil can increase your good cholesterol and reduce your bad cholesterol.
Interesting. Let me ask you that because for whatever reason, I eat well thanks to my lovely wife at home.
Yes.
And my cholesterol is still higher than it should be. I don't eat gross food. I eat pretty well, exercise when I can.
Yeah.
Why?
Well,
I mean, doctors say it's, hereditary perhaps.
It can be hereditary
can I
for
lower
sure.
that?
You can. I mean, stress is one of the factors in life that can increase your cholesterol as well. And you want to look at other factors like your thyroid as well to see, make sure that's functioning well. But, I think stress is huge for you and getting proper sleep. And I know you're on your coffee challenge this month. So yeah, anyway, so I think you might be surprised.
But you can lower. That's what I want to find out is trying to get ahead of the game.
You can, yeah, especially with your nuts and seeds. Green tea. So I didn't talk about stroke, but if you increase your green tea, which I think you're doing right now, so about 3 cups a day can reduce your risk of stroke by 30% or 21%. Sorry. So that's something that at least you're getting reaping those good benefits.
I want to get to the other things. Chocolate. People say this is a good thing, especially on Valentine's Day.
I know. How could I not talk about chocolate on Valentine's Day?
So you're telling me I can eat as much chocolate as I want? Is that what you're telling me?
No, I am not. But you can enjoy a little bit of chocolate with some red wine, right, tonight. But this is actually 5 ounces of red wine. Just want to mention that. But anyway, with chocolate, it can increase blood flow to your brain and through your arteries, which is good, and lower your blood pressure. So I made you a smoothie today. There you go.
Thank you so much.
This has raw chocolate in there, which is so good.
Happy Valentine's Day. Thank you so much. Just cut out the alcohol. I think that's an important thing,
well,
right?
Well, it's important. Moderation.
All right, we got to go. Happy Valentine's Day.
Happy Valentine's Day.
See you in a moment.